Welcome everybody to tonight's Faculty of Education seminar on maintaining professional relationships in a post-COVID-19 environment. My name is Professor Andrea Ropert and I'm the Director of Psychology Programs here at the Faculty of Education at Monash University. I do want to do an acknowledgement of country and acknowledge the lands on which we all meet today and recognise that sovereignty was never ceded. I'd like to specifically acknowledge the Wiradjuri and the Boonwurrung people, the communities of the Kulin Nation, and as the ongoing custodians on the lands on which Monash now sits. We pay our respects through our research, teaching and learning to the Wiradjuri and Boonwurrung elders and their past, present and future communities, and extend that respect to any Indigenous people that may be here tonight. Okay, first, welcome everybody. It's wonderful to see you all, and I understand from many places around the world, which is really indicative of the importance of this topic, particularly in these interesting, challenging times. I would encourage you all to put your questions and discussion points and reflective things that you have on the YouTube chats. You obviously need to be logged on first to be able to do that. I also encourage you to use hashtags and tag on Twitter as well about this really important topic. Before we do launch into it though, I do want to very briefly let you know about the research agenda and our vision from the Faculty of Education, which is basically translational research that makes a difference to the students, teachers and the communities within which we live and we work. So we're on about collaborating, influencing and making change. That's our big vision. Within that big broad vision, we have various themes. The themes are around leadership, teaching and learning, sustainability, digital futures, diversity, inclusion, and enhancing health and wellbeing. And that's where tonight's lecture sits. Now, within enhancing health and wellbeing, our focus is really on promoting the mental health and the physical health of all the people that we work with, particularly young people, and the social determinants that inform that in a way that promotes physical and mentally healthy lifestyles and communities. Some example projects within this particular theme, of which we have many, and these are just a selective, but are around food education and policies around that, around increasing physical participation and strategies for doing that in informal ways, and finally online interventions for at-risk young people, at risk of their own mental health. And they're the types of activities that we've been involved in under that broad umbrella of enhancing health and wellbeing. Within all of that, you can see it's quite important that professional relationships, authentic, genuine relationships, are an important part of the way we do our work and the way we engage in our research and our outcomes as well. So, which brings us to the topic tonight, which is maintaining professional relationships in a post-COVID-19 environment by Dr. Nicholas Campbell. Before I pass on to him, I just want to give you a little brief background of who Nick is. Nick has been in the Faculty of Education for over 10 years now. He co-wrote the seminal textbook in ethics that's used in many psychology programs across Australia and overseas. He has advised on numerous ethical standards and recommendation guidelines to multiple professional bodies and government committees. And finally, he's a much respected educator in the area of ethics. In the words of one student, and I'd just like to read this out, this is a shock to Nick as well. Nick was the reason I came to Monash. He brought what I thought would be a dry subject, which is what ethics often is. He brought what I thought would be a dry subject alive. And with relevance to both my professional and my personal life. So I'm very confident that we're in very capable hands and on this really important topic with much relevance into the way that we all work today. So on that note, Nick, I'll pass over to you.
Good evening, everybody, and thank you, Andrea, for that intro, and thank you to the marketing team and the IT team for getting us up and running this evening. I'm really pleased to be here. It's not often I get to talk about ethics and professional practice for an hour without everybody telling me I'm boring and to stop doing it. So I'm really looking forward to the next hour. As Andrea said, my focus is on ethics and professional practice in psych and related professions, teaching, etc. So what I'm hoping to do tonight is to bring some insights into the challenges that we faced during COVID in terms of developing those relationships, maintaining them, etc., and also what that might look like in a post-COVID world. Now, obviously, this topic has been in play for a little while, and when I came up with it, I was hoping all of us might be in a post-COVID-19 environment. Obviously, we're not. All right, and so we'll consider the various stages that we're all in that space too. I must admit, when I was looking through the guests, the attendee lists, I was incredibly pleased to see so many past students and professionals as well in the list. So really good to see all of you here, and hopefully it's really a good sign that you come back to hear even more of me. Also, lots of current students too. So again, a pretty broad audience. So I'll endeavour to sort of try and provide something for all of you. So I think it is really important to think about your current settings and contexts. Within the faculty, we have a wide range of healthcare professionals and educators, and we train a large number of students in a range of areas too. So everything that I'm talking to you tonight, you're to some degree are going to need to think about how does that fit within your professional space, the roles that you undertake, the services that you offer, the courses you teach, the students you work with. So bear that in mind. All right. Also be mindful that, we're in a range of sort of COVID settings. Here in Melbourne where I am, we're all back to full lockdowns and, quite restrictive practices in terms of what we can even do in healthcare settings. I know for lots of the rest of you, though, you may be in international locations, you may be interstate where those restrictions aren't as rigorous. So again, kind of consider yourself in that context. And of course, as with anything sort of ethics and professional practice related, I'm never going to know all the details of your particular circumstances. So you're going to need to sort of be the healthcare professional or the trainee in the healthcare fields and work out how the things that we're talking about tonight really fit within your world and the sorts of services that you provide, etc. So just be mindful that there are lots of different spaces that we all may well need to be in. So I may not directly address your situation, but just kind of think about the broader context and think about how does this actually fit in your everyday world? Because if you're providing healthcare services or in educational settings, school settings, or if you're training in any of these settings, most of the stuff that we're going to talk about tonight is going to be directly relevant to you and the services or the education that you're providing. So I think we kind of need to start thinking as we sort of move through the COVID response, and depending again where you are in your sort of state or country settings, I think we're reaching a point where it is time to reflect and reset. So I think for me, when I was starting to think about this topic, I sort of went back to what did I do at the start of the COVID period when we started to implement lockdowns and restricted movements and not allowing face-to-face engagements. How did I come up with the tools and the techniques that I used? And I think it's really important for you also to think about that. I don't know what it was like for all of you in various locations, but certainly in my teaching, we were going to have 1 week online, and then we were going to be back to face-to-face, and the rest of the semester was going to be face-to-face. And then basically you get an email to say, no, we're going 100% online. And so it was a bit of a scramble. And so often in those circumstances, we fall back on the things that we're comfortable with, the things that we're used to. And, we employ the tools and the techniques that we've probably tried before. So I think it's one of those things that now's the time to reflect on that and go, did we actually choose the best tools? Did we actually come up with good scenarios, or did we kind of just grab what we could grab and run with it? Perfect example in my teaching. Typically when we have face-to-face classes in my ethics class, we have a big group presentation where 4 or 5 students present each week on a particular topic. It was week 2, we were going to have to change the assessment items. And in my wisdom, I thought, all right, students are not going to be that familiar with Zoom yet, so I'm not going to make them do a group presentation over Zoom or anything like that. I'll make them do a group written presentation, and everybody can upload an individual video that I'll evaluate. And that seemed like a brilliant idea. The students seemed relatively comfortable with that. I felt that we were going to be assessing the same sorts of key variables that we would have in the traditional assessment. And it wasn't for a few weeks that I actually realized, hang on, now I'm going to have 700 minutes of videos to mark that I've never had to mark before. And so again, I kind of just went with what worked at the time, but with some reflection, I should have thought that this is actually going to be a huge amount of additional work and quite a different task. So I think this is that time where we kind of go, all right, well, let's reflect on that. So I think for those of us heading back into lockdown, these practices, these tools, these techniques are now front of mind because we're having to do it again. In some cases, having to do it to an even higher degree or a greater level. So we really need to be thinking about, what worked, what didn't work, because we're using it again now. Right? And so we need to be mindful that what are we going to do? How are we going to do it? I think we also need to be careful that the mindset has perhaps changed a little bit, certainly in Victoria, where we're heading back into a quite intense lockdown period, or a couple of weeks in. It has a different feel to it. I think there was certainly sort of from the service provision and the teaching perspective, there was a huge amount of goodwill going around, and everyone was quite happy to sort of put up with some of the road bumps and the spills and just trying to figure stuff out. I think come lockdown number 2, where we're all back in remote learning and telehealth for most of our healthcare services, that mindset's changed a little bit. And again, I think we need to be aware of that. For those of you who are fortunate enough to be in locations where you have started to return to sort of a standard service provision and teaching setting, and I know some states in Australia had quite limited disruptions to teaching and healthcare, but for those of you who are fortunate enough to be in situations where that's happening, I think what you need to think about is what's worked well, what are we going to keep doing, how can we use the tools, the skills, the experience that we've gained now in terms of providing continued high levels of care. And so I think, for those of you in that situation, they're the sorts of things to reflect on. And for those of you still studying, there is so much research getting done right now in terms of COVID and the tools, the techniques, the learning outcomes, and perhaps for some of you in the teaching profession, we probably won't see some of that till we sort of start to see how the students do in terms of outcomes. But this is a chance where, there is a huge sort of transition going on. And for you in the learning, teaching, research spaces, there's going to be phenomenal opportunities for you to explore those sorts of things and to engage in what is going to be the next generation of teaching and healthcare in Australia and internationally. So I think it's an amazing time for you to be learning. And to some degree, you've also got a head start. You've got to experience, telehealth, or perhaps in your placements, remote learning. For those of you in teaching placements, perhaps if not this year, maybe next year, you get to do remote teaching placements too. So I think it's one of those times where, although it is quite challenging and quite tragic, at the same time, there's lots for us as professionals and educators to be aware of and to be contemplating and reflecting on. So that's kind of setting the scene for where we are. And as I said, everyone's in a different space and even different roles. So just bear that in mind in terms of the broader context. So the professional relationship. So as Andrea highlighted, this is kind of where we're focusing in tonight. And it is a really important area. And again, we're talking about multiple different professionals tonight. And I think all of them share some commonalities in terms of what it means to be a professional, the obligations, the responsibilities. But I think if we broadly think about that sort of teacher, healthcare, counselling, psych, practitioner type space, all of those relationships are sort of underlined by a power differential, in terms that the professional has some power over the people that they're working with. All right. And so for each of us, that we need to be really mindful. And I mean, certainly in the field of psychology, we're quite heavily regulated in terms of those professional relationships. We're required to have an informed consent document that is sort of the sort of legal framework for what it is that we're going to do with our clients. And within that, there's financial limitations in terms of how we financially interact with our clients. Aspects of professional responsibility. So there's a whole range of obligations, and obviously that's different for different professions, and there are sort of slightly different sort of takes on it depending on your field. But I think that the core thing that we need to remember in terms of those professional relationships is that there is that power differential. So in terms of psychology, most of the sort of regulatory bodies and codes of ethics make it very clear that is a special relationship, and that we need to be really careful not to be engaging in behaviours or other relationships that have the potential to negatively influence that professional relationship. Teacher codes, again, are pretty clear that you're there as the teacher, that you're there to provide, educational support, to provide perhaps sometimes pastoral care, perhaps sometimes some social supports, but you're not a friend, you're not a parent, you're not a carer. It's a separate professional role. Again, the counselling codes are all pretty clear in terms of it being a really key thing, that the professional relationship is special, and that we are really mindful about how non-professional relationships may interfere with that, and that we need to be careful that the professional relationship isn't impacted or damaged by the non-professional relationships. Right. So some of the examples I usually talk about is, you can imagine, let's pretend you're the client and you've gone to see a counsellor or a psych or a therapist of some sort, and you're going through a really tough time, and you have disclosed some really challenging situations that you're in, or perhaps you've been describing the worst day of your life, which certainly isn't an uncommon occurrence in terms of counselling and psych settings. And then the next day you attend a social event. You go to a kid's birthday, and they're across the lawn, you're all having a barbecue and a drink, and they're across the other side of the garden is your psych, right? You've just disclosed everything to them yesterday, poured your heart out to them. How are you going to feel that there's someone at that social kid's 4th birthday that knows everything? And even if you've had a really appropriate professional relationship, even if you've gone through a detailed informed consent procedure, as the psych, you can still imagine that if you're the client in that circumstance, you might be still feeling really uncomfortable that there's someone engaging in chatting to your friends, and are they saying all that stuff that I told them yesterday. So I think it's really important. And I mean, even things like doing assessments on family members, you can essentially put yourself right in the middle of family disputes. The parent wants the young person to go off and engage in this sort of profession, and the young person wants to do something else, and you do some sort of assessment that's then putting you essentially in the middle of a tug of war between family members. Right. So again, these are the sorts of relationships that we know can then negatively impact on that professional relationship. I think that sometimes those lines in the teaching profession aren't so clearly defined, and perhaps some try and argue that perhaps that relationship isn't as powerful. I'm not sure that I tend to agree. I can imagine, if you had a friend's child in your year 10 class and they're really struggling, it might be quite difficult for you to treat them just as you would any other kid in your class. Do you perhaps try and offer them more support or more help because you actually know them, and maybe you've known them since they were born because they're close family friends? How do you manage that? Do you do too much, or do you go, oh, hang on, I really don't want to get involved because I know this person in a social setting, and therefore I don't want to put them in an awkward setting? So it's one of those things that this professional relationship is really important, and we need to be mindful that we try not to engage in non-professional relationships that can influence that. I'll talk to you a little bit later on about what happens when we can't avoid those relationships, and also some of the questions to ask yourself when you are facing those situations, because often we see in some of the tribunal hearings, in terms of when psychs and healthcare professionals do the wrong thing, they try and come up with quite outlandish excuses to say, oh, no, this non-professional relationship was absolutely required. There was no way I could get out of it. But so some questions to ask yourself around that space. But the core message, I think, is that professional relationship is really, really important, and that we need to do what we can to maintain it, and to, as far as is appropriate and possible, to keep those non-professional relationships from engaging in it. Now, I think COVID has thrown up, and I mean, not necessarily COVID itself, but lots of the things that we've done in the COVID space have made this a little bit more challenging. So I think I've come up with a list, and again, depending on your setting, depending on the services you offer, you might have a very different list, or you might agree that all of these things have come into play. So obviously, for a lot of us, technology has gone through the roof. I reckon I've spent more time this week on Zoom than I would have for the whole of last year. And I already use Zoom a bit. All right. So it's kind of one of those things. It's completely revolutionized how we do a lot of things. I think technology, though, is much broader than that. So don't just feel that when I'm talking technology, I'm only talking video conferencing. We'll talk about a few different aspects. But I think security is a really important factor. I usually spend at least a couple of hours during my postgraduate courses when I'm teaching 4th years and 5th years, basically just terrifying them about technology. That's not my aim tonight. I think technology has helped us tremendously. Just imagine if we were going through this pandemic 10 or 15 years ago, no broadband, no mobile phone data. It would be a very different circumstances that we would be finding ourselves in. But I think we do need to be really mindful of the security aspect, and whatever tools that you are using, being responsible for those. Most codes of ethics, most sort of ethical guidelines, most codes of conduct, most codes of practice actually don't make any mention of the media or the technology you're using to provide your service or to engage in the education space. It really typically is on you as the service provider or the educator to actually say, all right, well, this is what I've got to do. How do I do that using the technology that's available to me? So it's really important that you are confident and comfortable with the technologies that you use, and are comfortable in their security. Unfortunately, we've seen some pretty amazing workarounds, often by students, getting around their technology. Some of the best ones I've seen is, where students take a video of themselves just sort of sitting there, occasionally moving, and then set it as their virtual background on Zoom. And then they just walk away from the computer, and it just looks like they're sitting there nodding away to their teachers' discussions. So we see all kinds of things like that. What I typically do in class, and I'm not going to do it for all of you because I don't know where you are and what you're doing. Normally, I will call out to your digital assistant. So be that, Google, Siri, Alexa, and just ask them questions over Zoom. And you'll be surprised how many of your phones will suddenly come to life and, start Googling whatever I've asked them to Google. And again, you need to be pretty careful if you're teaching a bunch of, Year 9 students, and you leave your phone next to a computer speaker unattended. Who knows what they'll be getting your digital assistant to search for. So those sorts of things are really important, and I will be on really what I'm going to get into tonight. But I think it's really important to be comfortable and secure in whatever technologies you're using, and ensuring that they are providing a safe and appropriate communications medium for you. I think we also need to be really mindful of the technologies that we're using and the impact that they are having on the professional relationship. So, we've all got really, really good that if we're doing hand gestures, everyone now does hand gestures in front of their face because, you know, if you do hand gestures, you know, at waist or chest height, it doesn't get picked up by your webcam. So those sorts of things are just becoming unique, becoming ubiquitous. And I must admit, I've noticed myself doing it in live face-to-face interactions too. My hand gestures are way higher than they used to be. And that's the necessity of interacting through these sorts of mediums. And I think it's one of those things that you just need to be mindful of that. You know, what happens if things go wrong? So, you know, normally I'd be doing this presentation from uni with all uni's support services. Right now, you know, if the power goes off, my backup plan is, you know, an iPad and a phone on battery backups, a couple of torches, and you'll still be able to see me. After a few minute delay, I get it all set up. But again, you know, these are the sorts of challenges that we face when we're engaging in these sorts of spaces. So I think it's really important, again, for viewers, professionals, both, you know, educational, healthcare, whatever it is that you're doing, to just be mindful of those sorts of interactions. I mean, again, you know, when we engage in these sorts of spaces, you know, you're seeing from here up. Does that matter? You're seeing from here up on your clients too, or your students. Does that matter? Maybe, maybe not. That's something that you really need to think about in terms of the services that you offer, the clients you work with, your students. You know, what are you missing out on that normally might guide, you know, what it is that you do? So I think it's one of those things that we've all, well, we might not all be super comfortable with technology at this point, but I think probably all of us are a lot more comfortable than we were, you know, 4 or 5 months ago. So again, just thinking about those sorts of aspects. And of course, you know, delays and distortions. I usually like to take live questions as we're going along, but I think there's a 30-second delay between me talking and it popping up on YouTube. So obviously I can't take live questions because it would just be beyond my capability to keep up with myself from 30 seconds ago. But again, these are the sorts of challenges that you just need to factor into whatever it is that you're doing in terms of service provisions. Another one that I'm usually pretty big on is just being mindful of the tools that you use, both sort of professionally and privately. All right. So, you know, if you're using WhatsApp, basically you need to be giving away your mobile phone details. And again, maybe the people you're working with already have those, but if not, be mindful of what impacts that might have. You know, if you're using Facebook Messenger, well then, you know, you're opening up your whole sort of Facebook potentially to clients and students. If you're using, you know, so any of the other tools, just be aware of those sorts of issues. And I mean, it can be as simple as using the same, you know, the same email address on your personal and your sort of professional social media accounts. They can get linked together, and you'll start to get, you know, invites from students or clients or whatever it might be. So I think it's really important that even if you don't necessarily change what it is that you're doing, even if it is that you don't engage in those sorts of spaces, just to be aware, to ask yourself the question, am I comfortable with this? You know, what are my students going to see? And just being mindful of that sort of stuff. As I say to my students when I'm teaching them, I can absolutely guarantee you that, you know, 90% of your clients are going to Google you and search you on social media before they come to see you. It's just the world in which we live. You don't have to be comfortable with it. You just need to know what's going to happen. Right. And so just being mindful of those sorts of transformations. And again, because now we're interacting with so many people in online, we may well be providing them with more information to work with, or more information to search for, or more usernames, or whatever it is. And again, for a lot of people that might not be an issue at all. But it's one of those things that, again, as I was saying at the start, we just need to reflect on and think about that. Is this a problem? Is this something that's getting in the way? And I think also we need to be mindful. So, well, before we went into stage 4 in Victoria, we had a short window where we were both required to wear masks, but we could still see clients in healthcare settings. So I know at the Krongod Clinic, in our sort of psych clinic in the faculty, we had the interns were sending photos of the kids they were about to work with their masks on, and a photo with their masks off, to kind of, again, highlight the changes and to prepare the kids for what it might look like. And again, I think that's probably some of the best practice stuff that we may continue to do long term. So I think it's one of those things. Just be really comfortable and understand that the tools and the techniques that you use. I think the next thing you need to be thinking about is your location. So we've all, well, the vast majority of us have sort of shifted from a working at work space to a working at home space. And again, reflecting on what that means, right? Understanding what is it that we're sharing. At the moment, I've got this lovely virtual background that doesn't say much. But again, I've seen lots of people with really cool virtual backgrounds that actually, to me, would be the initiation for lots of conversations that, as a psych, if I was providing services to them, I really wouldn't want those conversations to be starting, because it would potentially be engaging in some of those non-professional discussions that we know can sort of start to engage in boundary crossings and boundary violations. So they're those sorts of behaviours whereby the boundary crossings are where you're engaging in things that you wouldn't typically in a professional setting, with some benefit to the client. So there's still risky behaviours, but perhaps there is sort of good therapeutic or educational use to them. And the boundary violations are that next step where there clearly is some negative impact of what's going on the client or the students. And so I think we need to be really careful about the sorts of things that we share in our backgrounds, because it is going to highlight the sorts of things that we're interested in, and the sorts of things that perhaps can start those non-professional relationships. I actually had a whole lot of virtual backgrounds that I was going to flick you through. Unfortunately, my beard does not agree with virtual backgrounds. And so what often happens is the virtual background appears in the background and across most of my face. So I'm not going to do that now for fear of having weird recordings of me with stuff all over my face. But just be really mindful about the sorts of information that we are sharing, where it's coming from, what potential impact is that going to have. And again, like I said, it may be none, but if you don't reflect on it, you're not going to have any idea about it. So then we flip it over to the other side in terms of what information is our clients sharing with us, or our students sharing with us, based on their locations. So essentially, I think of it as when I'm on Zoom with clients or students, then I'm basically in their house, right? And I don't know how many of you have spent much time sort of working one-on-one with people on Zoom. You'd be amazed at the things that microphones pick up. I had someone the other day who had this beeping noise in the background, and I had absolutely no idea what this noise was, and they couldn't even hear it. And apparently it was something internal on their computer beeping that I could hear through the mics that they couldn't. So, and again, you hear lots of background noises. And what we need to be careful of as professionals is all our professional obligations still apply. So for most of you in teaching and healthcare professions, maybe not the counsellors by registration, but certainly by some of your workplaces, you may well be mandatory reporters of child abuse, right? And so the things that we're seeing in our clients or our students' homes, our professional obligations in terms of reporting still apply. Same for teachers and your child safety standards and working with young people. All those sorts of obligations still exist, even though we're now engaging in a virtual space. So it's really important that we're mindful of informing our clients of that, of explaining that, letting parents know if you are on Zoom and you can hear a whole lot of things going on in the background, that we do need to be aware of that and to be on top of it, and maybe, again, doing nothing about it, but maybe needing to engage in some way. So yeah, I think those are some of the real challenges that I've seen crop up, and talking to educators and healthcare professionals. And I mean, again, you may have some quite specific aspects in your workplaces too that you feel that some of these changes have impacted on and have really impacted on the professional relationship, or you feel suddenly that clients or students are far more in your world than they used to be, or vice versa, that you feel that you're not necessarily imposing, but that you are seeing or hearing or having too much involvement in their spaces too. So for me, that they're kind of those core issues, and they may look slightly different for everybody. And again, internationally, you may have different impacts again. But I think it's something to think about, something to reflect on, and it's just something to just be mindful in whatever it is we do. Like I said, often we got thrown into this situation that we're finding ourselves in, and we haven't had much time to reflect, and we've just been run off our feet desperately trying to keep our heads above water and provide the services that we know we have to provide, and to provide the teaching and to keep up with our students and all those sorts of things. But I think we do need to stop and just think about how these things are impacting on us. So for me, they're the challenges. Obviously, it's not all doom and gloom. I'm not just going to leave you with the challenges and sort of say, figure it out. I've got some suggestions about how we can maintain strong professional relationships. Some ideas about minimizing those non-professional relationships, or the potential for non-professional relationships to start. In my psych classes, there's Nick's golden rule. Nick's golden rule is you never have sex with your clients. If people take nothing from my full semester's worth of ethics and professional issue, they take away Nick's golden rule. All right. And my bronze rule, after lots of discussion with students, my bronze rule is don't have a cup of coffee with your clients either. Because it's pretty unlikely you're going to start having sexual relationships with your clients without having those small non-professional interactions on the spectrum. All right, so we'll have a bit of chat about those, and we'll also have a bit of a chat about harm minimization. That'll be the next section. Hopefully I'll give you some solutions and some ideas about how we can, if not completely solve these problems, at least start to be aware of them and think about how we can improve our professional relationships, minimize the others. And when harm minimization becomes the focus, when we really do have non-professional relationships that we can't avoid. So I think the first aspect, and to be honest, this is probably true for all of them, is communication is key. All right, that engaging, discussing, communicating really is the best way for us to get on top of some of these things before they get out of hand. And I think perhaps what COVID has done is some of us have had to sort of drastically change what we do. I know I probably spent a lot more time in my teaching spaces talking about what we were going to do and how we were going to do it and how we were going to manage it and what we were going to do if it all went wrong. I'm not sure I really spent much of the time before COVID when I was teaching face-to-face doing any of those things. I'm sure I did to a degree, but certainly not to the extent that we have when we knew students were facing different circumstances. Yet, to be completely honest, when people are coming into our postgrad programs, new staff, new teaching, new building, new facilities, new expectations, those sorts of things were always a challenge. But because there were these new circumstances, I focused more on it. So I think communication is key. Right? So engaging, focusing, on what is the core professional service that we're offering. And obviously for us in healthcare, we often have, formal informed consent documents that kind of dictate exactly what that means. But I think for all of us in education, in healthcare, in support, we can probably do a better job of communicating both initially with our clients and our students about, hey, this is what we're doing. This is what it's all about. And also then ensuring that discussion continues, that it isn't just well, I know what I'm doing, so I'm just going to keep doing it and no one else needs to worry. So I think communication for all three of these that we're going to go through next is pretty much underlying everything. And hopefully as, educators, healthcare professionals, that should be our strength. But maybe sometimes we forget just how important it is. So I think, as I said before, discussing how technology or other changes, and again, not necessarily video, may well be, wearing masks, wearing face shields. How is that actually going to impact on things? Right? Discussing it, trying to, preempt some of those challenges that we know we're going to be there. Like I said before, I've got this contingency planned for if the power goes off. I'm going to be back up and running in 5 minutes and we'll continue on. And again, if you're providing healthcare services or you're providing teaching services, you kind of need a backup plan, because what happens if it does just go, black screen, everyone's gone. You might have a class of 30 kids all just sitting there going, this could be fun. No teacher, let's get crazy. Or you might be working with someone, in a really high level of need. What do we do? And of course, the flip side of that is what happens if if it's the client's technology that falls over. So I think that's really important. As I said before, I think clarifying the limits of the professional relationship is something that we do really well in some circumstances, but possibly could improve a great deal on. And again, the COVID settings, or for those of you in states or countries where the restrictions are starting to wind down, this is the perfect chance for us to say, all right, well, things have changed, and this is how this service is operating. And I think, again, with telehealth especially, we need to be really mindful that we aren't just available all the time. We do need downtime. We do need to make sure there are clear boundaries, so we're not, getting, Zoom calls or FaceTime or whatever it might be at, midnight. We need to be setting those boundaries. So I think, again, communicating, especially now that things have changed, is quite easy in terms of, right, well, this is what the professional relationship is going to look like now. And we can use those changing circumstances to do that. I think identifying and discussing the shared difficulties is always going to be important. And putting people at ease that, what, this isn't ideal, but this isn't by choice. I know a lot of my students this semester were really keen to get back in the classroom. To be honest, I might be more keen than anybody to get back in the classroom. But, we're not making the choice not to be there. We have this shared set of circumstances that we just can't get around. And so therefore we need to make the best of those. So I think identifying those, clarifying those, helping identify where things really are, because there simply is no other option. This isn't because we don't like interacting with you in a face-to-face environment. There are clear difficulties. I think the other side of that is acknowledging and addressing where there are individual difficulties. So I know in teaching spaces, I've sometimes had students saying, look, Nick, there's just no way I can turn on my webcam and engage with you when we're doing big class activities, because I'm here with my 5 kids, all who are doing remote learning, and there's 5 webcams and there's 5 people chatting and there's just no way I can do it. And again, understanding that those unique challenges are going to exist, and to some degree, hopefully trying to find ways of alleviating that. And again, in the healthcare space where, at the moment, pretty much, unless it's urgent care, everything is getting done via telehealth or being delayed, having to come up with quite innovative and creative ways of providing services that just have to be done. And again, sometimes that's going to require the healthcare professionals or the educators to be quite flexible and to find ways of getting around hurdles that, on the face of it, may well seem insurmountable. And let's face it, if you'd gone back to December of last year and told us that we would have done what we'd done in the last 6 months, I certainly wouldn't have believed you. I'd have said, no way, that's not impossible. There's simply no chance we could pivot from, face-to-face teaching to 100% online teaching, from face-to-face healthcare to, a very large chunk, 60 or 70% of healthcare getting done via telehealth. Now, it just won't happen. It's not possible. We can't do it. But you know what? We did. So again, it's one of those things that we need to fall back on the fact that we've actually managed to do a tremendous amount in the last 4 or 5 months. So we need to bring that sort of can-do attitude to engaging in when we do find situations that really are quite challenging at an individual level for educators, for healthcare professionals, clients, students. We need to get a bit creative. So as I said, I think communication kind of underlies all of those. I think it's also a matter then of making sure, and I'll talk about this in the final slide, about really grabbing a hold of what works, harnessing technology for doing what it does well, right? And choosing not to use technology in situations where it doesn't do so well. So I think in time, hopefully we get to a space where that is a possibility. As I said, the next step in strong professional relationships is minimizing those non-professional relationships. Right? As we talked about before, that power differential is really, really the sort of key driver of this, and that in the worst of circumstances, these non-professional relationships have the potential to be very manipulative and coercive, and can sometimes very negatively impact on the professional relationship as well. So I think it's really important that we're vigilant in this space. I think because we are spending so much time online and using so many different platforms and interacting in so many different ways, that we do need to be really mindful about how much information we are sharing. I'll be honest, it's a bit of a generational thing. I think I'm almost in like the older age group perspectives when it comes to social media. I know many young people are quite happy to share everything about their lives online with everybody, and really don't find that to be a concern at all. And who am I to judge that? But at the same time, I think you need to be really mindful about what impact that may well have on those professional relationships and how you are perceived. Because again, you've got to be thinking about potential clients and potential employers. Again, going to have very different perspectives on those. So my advice, and as I said, I'm usually pretty keen on terrifying most of my postgrad students when it comes to social media and social interactions online, is just to be careful. I'd say be really incredibly careful about accepting friend requests or following or allowing students or clients to follow you. Certainly in a healthcare perspective, if you're providing counselling services, being really mindful of the sorts of clients that you're working with, and again, that social media presence, because quite often, that they will be working with attachment issues, and they will be working with loneliness, and they will be quite keen to make connections with you and try and build those friendships and to build non-professional relationships, because you are a person who's been sitting there listening to their troubles. You'd make a fantastic friend. So I think be really super careful of that social space online, because it does have the potential to develop those non-professional relationships. But again, I think be mindful of you, your context, your work, etc. As I said before, be really mindful of what information you share directly and inadvertently. As I said before, we've all seen some of you may not have, but I certainly take quite an interest in some of the sort of goofy things that you see people have done on Zoom and the mistakes they've made. And again, I think it's really important to understand the technology we're using and to be careful about what it is that we're sharing with the world and what's being shared by us inadvertently. The one thing I will say is do consider cultural nuances when evaluating some of these non-professional relationships. So back in the world where we actually had physical contact with other people, my general rule was that if you're a psych or a counsellor, I was happy with you greeting your clients or your clients greeting you in the same way as they greet their local butcher or their local greengrocer, right? Because there is a whole lot of cultural nuance in how we do interact and how we physically engage. For some people, a handshake or a hug from a client is really confrontational, and putting my ethics hat on, I'm going to say we're never hugging in clients pretty much ever. But again, those cultural constructs come into play, and if your client is quite happy to hug their butcher and their greengrocer, then maybe I'm okay with them hugging their psychs as well. Maybe for those of you who've been in my class, you know how much it hurts me to say that. But I think it's one of those things to be really, really mindful of those cultural nuances, both yours and theirs. I think the final thing to be really careful of in these non-professional relationships is it doesn't matter who initiates the non-professional relationship. You as the professional have to be the one that makes sure that those non-professional relationships don't go further than they have to or don't occur at all. So it doesn't matter how much the client or the student or whoever it is the one who really wants to start a non-professional relationship. You as a professional have got to be the one to put those boundaries in place and to deem whether or not that is or isn't appropriate, right? And again, these can get quite complex if we are talking about teachers in schools where you may well have friends who also have kids at the school and things like that. So there's no sort of hard and fast rules for this sort of thing, but the important aspect is to be aware of it, to be vigilant to it, to be mindful of where those things can crop up and how they can become challenging for you in your professional context. All right, so the final aspect is, all right, if these non-professional relationships really can't be avoided, then what do we do? And so harm minimization has to be our focus. All right. So again, in most circumstances, I'm certainly for the sort of the psychs and the counsellors, I'm really pretty structured in terms of professional relationships are special. They shouldn't be, you shouldn't be engaging in professional relationships if you do have non-professional relationships with your clients. But there's always some grey. Right? One of the key things I think for you to reflect on, if you do think that these non-professional relationships really are unavoidable, is consider the motivation for the non-professional relationship. Why is it that this just can't be avoided? Is there the potential for it to harm the clients or the student, depending on your context? Is the non-professional relationship going to get in the way? All right. So I think it's really important that we think that through, that we assess it. And my feeling is that if you really do feel that these just can't be avoided, then you need to be talking to your boss, your supervisor, someone in somewhat of a position of authority to actually say, you know what, I think that this relationship really just can't be avoided. However, I'm comfortable enough in the fact that I'm engaging in this non-professional relationship to tell you about it, right? Because to me, that really is displaying a higher degree of comfort, and the fact that you are willing to share it. I think as soon as you get to a point of you going, oh no, there's no way I'd tell my supervisor that this is what's going on, then again, be really careful in reflecting, why is that relationship not problematic, right? And so I think those three questions can sometimes give us a head start in terms of, is this actually a problematic situation? If they can't be avoided, then I think we need to take a really proactive approach. Certainly in the healthcare professions, there should be really clear, informed consent documents that highlight how you're going to manage that. So to discuss how those potential risks will be managed. So, as psychs, we usually say to our clients, look, if we were just to see each other walking down the street, we're just going to totally ignore you, right? Because as soon as we engage, if that person is walking down the street with their friend or their partner, and we say hi to our client, and their friend says to them, oh, who was that just says hi? That our client either has to say, well, that was my psych, or they have to say, I'm going to lie to you and not tell you who it is. We put them in an awkward position. So really discuss how we're going to manage those sorts of things. All right. Put measures in place for the things that are really highly likely to occur. So from my perspective, in most of the healthcare fields, and to some degree, I guess, teaching as well, most of these sorts of situations are going to occur when you're a part of a small group in addition to your professional role. So you might be you might live in a small country town, you might be a member of a relatively small cultural group or language group or religious group, whereby you do just interact with people in that group at a much higher rate than general population. And it just so happens that some of the people in that space are your clients as well. Right. But again, being really mindful that if they are unavoidable, provide examples of how you will manage them. And sometimes it will in fact be us, the professionals, that need to do something about changing our behaviours. So like I said, if you're in that situation where you're at the barbecue and you see that your client's there, you may just decide to sort of, whichever end of the garden they're at, you're at the other end, to try and do what you can to minimise the harm. Again, if you're in a small country town, you may have to have some quite extensive discussions about what are we going to do about bumping into each other all the time, and how are we going to manage that, and what are we going to do. And I think that's again a really proactive step to try and ensure that these non-professional relationships don't get in the way. All right, so just a bit of a summary, because by some miracle I'm not massively running late, as is usually my case when it comes to slides. I think our next step is thinking about what comes next, right? And I think what we need to do is acknowledge the fact that we've been through and are continuing to go through, and who knows for how long, some really difficult times, and that that there have been huge challenges and huge tragedies, and that we acknowledge and understand those things. But I also think that, as is often the situation, that from some of those really tough situations, the silver lining is the fact that we do make great leaps forward, that we do, discover new and different ways of doing things. And certainly in the health field, I feel that telehealth has probably jumped forward sort of 5 to 10 years in the last 6 months. And so we are now in a position of understanding what works, what doesn't work, the tools, the techniques, what we still need to do. The challenges are, there are some things that we still just cannot do via telehealth. And we're going to need to figure out ways to do those things via telehealth so that we can engage. I mean, in the teaching space, I'm not sure that anyone really envisaged ever sort of going, all right, let's send the entire state to remote learning. Obviously there's sort of, distance education and a few other programs like that where clearly this is what they do. I'm not sure that anyone has ever thought that, let's just send everybody online. So again, we're going to learn a tremendous amount from that, not discounting the challenges, but I think that we hopefully will learn a lot from that. And I think what we need to do is to build on that, to figure out what works. There are always going to be students, clients, who live in remote areas, who have perhaps disabilities that make it difficult to attend. For them, this has actually been a process by which they have actually received far more service than they typically would. And so I think we need to understand, what's worked really, really well, and what are we going to keep doing? I know just from, our workplace, I dare say we're going to spend so much more time in Zoom meetings than we are in face-to-face meetings, because we've just discovered how effective they are, and we actually get a lot done, and it means less travel time. And I can see that that's something that's going to stick. In the education spaces, what has worked incredibly well? What is something that we may never have got to if we hadn't gone through this situation, that we may be doing for the next 20 years, that simply wasn't ever on the cards for us to do. So I think while we're still going through this challenging time, I think we also need to be thinking out the other end of it. What are we going to take from it? What are we going to learn? And I think for those of you who are studying right now, this should be, when we get through the challenges, this should be a tremendously exciting and exhilarating time, because you're getting to see things that, typically would have taken years to sort of work their way through the pipeline, and you're getting to see them all at once. I also think, as I said before, communication really can blossom from this, and hopefully we can really build on some of what I think we've done really well in explaining to clients and students what it is that we're doing. I think the teaching profession has probably experienced a positive uptick in just how much parents and students appreciate you and what it is that you do. So again, I think we need to harness that and to use that in a positive sense, and perhaps also highlighting the role that parents and learners play in that space too, because perhaps some of the tools and techniques that we've been using have in fact been really useful, beneficial, led to really good outcomes. I think that for me is the takeaway message, that there are lots of challenges and we still need to be tackling them in our service provision today. But I think that hopefully we can have got a lot from this, that we can learn, that we can adapt and take the benefits from that. Well, that's a very positive take on it, and I know sometimes it's pretty hard to do when we're in the midst of it. But for me, that's my aim from this year, is to, and hopefully we're coming out of it sooner rather than later, is to really focus on those positives. All right, pretty much smack on an hour. I'm rather pleased with myself, I will say. Hopefully you enjoyed it. Like I said, maybe I haven't answered any of your questions directly, but hopefully I've at least helped you ask the right questions. And sometimes that's what the ethics is all about, to reflect and to think about, okay, what is it that I need to think about? What is it that I need to change? What is the core issue in the professional relationships? I've got some references here for those of you, and obviously you can flick back on the recording and have a look at those if any of them interest you. But other than that, thank you for your time. I know we've got some time for questions now. Hopefully we've got some interesting ones to throw at me, but thank you.
Thank you, Nick. I think that certainly has challenged a lot of thinking and particularly around personal relationships. I'm going to throw to, I think, Chantel and Grace, who have been collecting questions as the sessions have been going. Continue writing some questions if you have any others, and we'll try to respond to them as well as we can in the next 20 minutes or so.
Hi, so I've got a question here from Kellyanne asking, do you think #medbikini will cause a generation of confused psychologists related to what is appropriate to share/disclose on social media?
Yeah, just thanks everyone. Give me the nice tough question at first. I think it's, if nothing else, it's raised our awareness of the issue, both in terms of perhaps the generational, maybe the gender divides in terms of what professionals and graduates may think is appropriate. Again, I think I'd tie it back to that original point that I made in the slides in terms of, I'm not going to tell you what to or not to put online. All I'm going to tell you is that, every one of your clients and probably every one of your employers ever is going to see it. And if you're comfortable with that, that's fine. I guess the flip side of that is you also then need to be aware of how comfortable they might be with that. And to be honest, that's all you can really do. As long as you're aware, as long as you understand, you post whatever you want to post. Unfortunately, it may lead to reduced clients or clients seeing it and going, I'm not comfortable.
Do you want to explain, sorry, Nick, just to jump in, do you want to explain what that was about in case there are people
my apologies. I just assume everyone's in my ethics.
Oh, they might.
And they all away. So basically what happened is, I think it was late last year, a paper based on a presentation came out that was highlighting what they considered to be inappropriate behaviours from healthcare professionals online. And one of their categories were, and I don't want to misquote them and I don't want you all to think that I'm judging, but I think that was something like provocative bikini photos from female surgical interns. The actual paper actually had a lot of other categories, but obviously that's the one that sort of got picked up on as being particularly judgmental. And I both understand the perspective of the interns of basically saying, stay out of my life. If I want to post photos of myself in bikini, I will. I can also see that for some people, historically, they may feel that that's an inappropriate thing to do. When you compare it to some of the other things in the paper, things like interns engaging in racist and derogatory commentaries, posting videos of them drinking and engaging in illicit drugs. I'm not sure that they're all in the same category, but there's been quite a lot of chatter over it. For those of you interested in ethics, definitely do some reading and have a look at it for yourself. But I think in answer to Kelly's question, yeah, maybe that is the outcome. There's a whole lot of people who are now not really sure what's okay. And to be honest, if you're thinking about that and if you're reflecting on that, again, maybe that's a good space for you as professionals to be in.
Thank you. Chantel, I think you've got another question.
Yes, I do have another one, Andrew and Nick. We've been getting a lot of chat actually through online on YouTube. Great discussions here from a variety of people. I've got a question from Mayo. How do you think about the relationship between online learning and standardized test? Did the online learning experience positively impact on teachers?
That's a really big question. I think I'll probably have to answer it from my own perspective because I think everybody probably thinks about it differently. For me, I was very, I'm trying to think of the right, cautious about heading into the online space, and I had some real concerns, not only over my ability to do it, but just the technology, because it was something that I hadn't spent a lot of time doing. By about week 4, I was going, oh, this is all right. And I think by the end of semester, I actually was doing some things a lot better than I was in a face-to-face setting. So again, I think, next year, if everything's back to, normal, whatever that may end up looking like, I think there are definitely some things that I'll do in the online space that I haven't done in the past that I will continue to do in an online space because I think it works so well. For me, my students did pretty much exactly the same this year as they did last year. So I don't think from my perspective that the face-to-face versus online had a huge impact. I think different units will be different. I think ages of your students, again, might be a really key factor. I think probably some of the longer term research might have some really interesting things to do with, the role of parents in remote learning and how different parents engage differently with that space. In terms of purely standardized testing, I don't know. There's plenty of debates in the literature in terms of its of how accurate and how valuable it is anyway. And so I think online learning will have just added one more variable that we start to consider in terms of those sort of high stakes testings.
Sorry, I had myself on mute. Grace, you've got the next question.
Yes, I do. And this question is from Zoe. So she's asking, given we have been in an era of accountability and risk management, how do you think attitudes to professional relationships and boundaries might change permanently because of COVID?
Well, I guess I would fall back on most of our codes and our professional standards and highlight that, the medium shouldn't really make much difference. That if a relationship was appropriate in a face-to-face setting, then it probably should still be appropriate in an online setting. That said, I think technology probably influences some aspects of that. I also think that we as individuals have very different aspects in terms of how we interact in an online space. Some of us do. And I know probably for those of you, let's say, under 30 out there, technology, social media, digital world, that really is your life. It's what you've grown up with. I'm old enough to remember not having an email address. Just remember not having an email address. But, it's one of those things that I think our relationship with technology to some degree influences our relationship with the people that we interact with using technology. So I think from a purely ethical and professional issue, I don't think it should change, but I acknowledge the fact that it probably does. And again, being vigilant about it, being mindful of for a certain generation of us, there's the real world and then there's the online world. And I think we need to be really clear that divide simply doesn't exist. And we need to be really mindful that online is just as much real life as face to face. And I know for a lot of you younger people that doesn't cross your mind that they are the same. But for a lot of older people, and I'm including myself in that older people category, we still remember a time when it wasn't.
Yeah, so do I. Chantel, you've got the next question.
Yes, I do. There's a lot of questions coming in now, Nick. So we've got one from Erin. Do you have any tips on how to help students learn to make ethical decisions when given conflicting info? So, for example, we shouldn't accept gifts from clients, but for some clients from some cultural backgrounds, this would be viewed as very rude and could damage the professional relationship. So what would you recommend to do?
Yeah, and that again, as I highlighted before, that cultural nuance is something that we really do need to take into account. I think if there was probably a simple answer, we'd already be doing it, and I'm not doing it. So I hope there isn't a simple answer out there, because I've been misleading my students for the last 15 odd years, if there is. I think, again, it's that idea of being aware, of understanding that the purpose behind it. Is this someone who is bringing you a small token of their gratitude of a long service provision, or a teacher at the end of the year, or is there someone who is constantly trying to give you gifts, constantly trying to provide you with something that's going to create that non-professional relationship? How do you evaluate that? probably, to be honest, it's mostly experience. So I think for younger psychs and younger teachers and counsellors and therapists, I think I would suggest to just tread very carefully in that space and to really evaluate it, not necessarily to instantaneously reject every single gift, not to instantaneously accept every single gift, but to think about the purpose. And in some cases, actually to discuss it with the client, especially if it isn't sort of, this is our last session and we're never going to see each other again, hopefully, because you've done a good job. Or, the teacher at the end of the year, if it is something that, after 4 or 5 sessions of a 10 session thing, they're starting to bring you gifts, it can get tricky. And I mean, there are also, really challenging things. I've heard of psychs where, clients have bought them cakes and the cake is basically inedible. So here's something where they've bought you a gift and say, oh, here, have a piece of this delicious cake. And you wind up with food poisoning for the next week. Some of those things just at a practical level can get really, really tricky. So I think being actively aware that this is an area that there is some grey, and to discuss it with supervisors and if need be, discuss it with the clients, highlighting that, this isn't a typical part of the professional relationship. Why are you trying to give me gifts and presents? And again, like I said, I think there's a lot of nuance there versus, a teacher working in a school versus even a psych working in a school where someone sort of got to the end of your grade 6 and you really helped support them, versus a client who you're working with who has, profound difficulties developing relationships and is perhaps looking for something different.
Yeah, interesting. Grace, you've got the next question?
Yes, I do. I have a question here from Shane. So, thoughts on inadvertent disclosure of personal information when doing telehealth? Clients would normally never see my large toy collection when doing face-to-face, but they do on Zoom.
Yeah, it's one of those things that I think it's not the end of the world, but it's going to be, for some clients, that's now going to be something that's let them just into a slither of your real life. Your life away from being a professional, to just kind of to give them that in, so that they say, oh, I saw you had this, amazing whatever it is in the background. I've got one just like it, or I'm really interested in trading. Would you be interested in trading your whatever for my whatever? And it just starts that incremental step towards having that non-professional relationship. All I can suggest, Shane, is one of these amazing virtual backgrounds. Like I said, they can get you into trouble though. I'm just seeing if I can choose my virtual background. So so there's me. I love a cruise. There's a lovely cruise ship, and straight away we've now got something that we can talk about. If a client sees that about cruising and holidays, and oh, where do you like to go and what do you like to do, and it just opens that door a tiny bit. So I think as long as you're aware of it, as long as you manage it, if you have a client who suddenly starts talking nonstop about toys, well, then you can be pretty sure you've just kind of opened that window. But again, I think you manage it, you discuss it, you highlight it. You can only do what you can do.
Okay, I think we have time for just one more question. So Chantel or Grace, have you got one last question, I think?
Okay, no problems, Andrea. We've got one from Lee. What is your opinion on the recording of sessions and the use of these recordings by the teacher, psychologist or counsellor, and these being sub-phoned in the future for mandatory reporting?
Yes. So this is a really interesting space. And again, one that we will probably see a lot more research and a lot more professional content coming out of very, very soon. I think there's sort of 2 different aspects to this. They can both be in terms of me, the professional, actually recording this session so that I don't have to take notes, or that I use this recording to create my notes from and then destroy it. Or in fact, it may well be the client recording things without the cycle, students recording teachers, etc. Again, I think communication is the key, to have a really clear upfront policy about what is going to be recorded, what's it going to be used, how's it going to be stored. And so I do know some psychs who, even when they were working in face-to-face settings, audio recorded everything they did, used those audio recordings as part of their notes. and then destroy the audio recording, and their written notes became their official record of the session. But they were really clear and upfront with clients about that. They highlighted that recording would be kept, till the end of the day when they did their notes. It would be destroyed, and the written record would then become the actual record of what had gone on. Now, obviously, in the telehealth space, that can be a bit tricky because there is certainly a great deal more potential for clients to be recording, and that then potentially could become, it could be something that did end up in a court case. And as psychs, that would be why I would be suggesting we have really clear communications about what is getting recorded, and that in the vast majority of situations that clients weren't recording their sessions. Again, it could be someone's just sitting there with a camera like this, just off to screen recording everything, and we would have no idea. The same in teaching situations. I think we need to be really careful about recording and storing, especially when we're talking about kids, any information that we're collecting and using. We need a lot of consent for that sort of stuff to be stored for ongoing use.
Okay. One final question, and then we'll wrap up. So, Grace, over to you.
Okay, our final question comes from Felicity. Telehealth has eroded confidentiality for some children, with parents listening with and without child and practitioners' permission. Will be interesting to see the long-term impact. Thoughts?
Now you're getting into a situation where I might give you an answer that goes for 2 hours. But broadly speaking, under most circumstances, parents are going to have access to their kids' psychological records anyway. It's a very long and complex process, but essentially with parents typically providing consent to their kids under, and again, this is very much a grey number. Typically we talk about kids potentially being mature minors from 14, 15, 16, but kids younger than that, it's usually the parents providing the consent. And so from a legal perspective, they are the people who will have the legal ability to access those records, to share those records. So in some ways, again, it might just be that it's a much more upfront discussion, and talking to kids about talking to kids and parents about the circumstances, how we're going to be using this technology. Is it you, the child, and then the parent sitting right on the side? It is a big challenge, and I think perhaps again what this does is bring it to the fore and makes us contemplate it, discuss it, how we're going to manage it, having really clear conversations with young people about their information and the potential for parents to access it, and also then talking to parents about what structures can we put in place that kind of create a bit of a bubble around young people to say, all right, as long as the young person isn't telling me, about risky sexual activity, about dangerous behavior, illicit drugs, as long as they're not talking about any of these risky behaviors, we can sort of have a bit of a confidential space between the psych and the counsellor and the young person. But it is a really complex issue. Some of my research students and Zoe's research students looking at it right now because it is a challenge.
Yeah.
And feel free, any of you, to just drop me an email. Just at nicholas.campbell@monash.edu, because I'm happy to have these conversations. And like I said, sometimes I'll go on for a really long time. So I shall stop now, because working with young people is a fascinating area in terms of ethics.
Great. Thank you so much. I think the as well as the nuances that you've really emphasised today, and they're not being necessarily a right or wrong answer, the one takeaway message is your golden rule. I hadn't heard that before, so I'll take that. Just in wrapping up, I really want to thank Grace and Chantel from our wonderful marketing team in the faculty, and Luke also from the Teaching and Learning AV sort of group for helping set this up and send out messages, social media and so on. Thank you so much, Nick, for tonight's presentation. I know it certainly got me thinking and thinking about how some of those same principles in face-to-face work can transfer, but also be under different sort of challenges, I think, in an online environment. So thank you so much. My final thank you goes to everybody who came tonight, participated, who gave some questions and raised different sorts of points as well. I really appreciate it. Thank you so much. And we hope to hear from you again.